Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about Bartonella. The reason I'm going to talk about Bartonella is that it is just so incredibly prevalent here in the Pacific Northwest, and there's not much lip service paid to it. I would say between 80 and 90% of my patients have Bartonella of one species or another. And there's many species. There's about 30 species that are pathogenic. And the two that are most well known are Bartonella quintana and Bartonella hensley, but there's Bartonella elizabethae. There's many different kinds of Bartonella that can be pathogenic. Bartonella is a gram-negative bacteria, and it loves to hang out on red blood cells. It is a persister infection. In other words, it has persister cells, and it's very difficult to get rid of. It's really difficult. And I know because I have it, and I've had it for 24 years. So I got it when I was, an adult. So it's much harder to get under control when you get it as an adult as opposed to when you get it as a child. So the symptoms can range anything from headaches, joint pain, profound fatigue, muscle aches, lots of eye issues, uveitis, epinodular scleritis, mouth issues, gingivitis, periodontal disease, trigeminal neuralgia, heart palpitations. It can cause POTS, postural orthostatic tachycardia. It can cause lots of GI issues, colitis, IBS, SIBO. It can cause interstitial cystitis in the bladder. It's just a really nasty infection, and it's not paid a lot of lip service. And I don't understand why. People say, "Oh yeah, it's a self-limiting disease." The heck if it is. It's hard to treat, really hard. Even Dr. Horowitz agrees. Dr. Horowitz thinks that Bartonella is the hardest tick-borne infection to treat, and I agree with him. So, he's working on that dapsone protocol, which we're trying to get an NIH grant to study, a double-blind study of dapsone for multiple tick-borne illness, and Bartonella included. So we'll see how that goes. With the current state of affairs and with a halt placed on research money in the United States, it might be a little bit more difficult than we thought it was going to be, but we'll see. He does have it. The grant is submitted, so they just need to read it and give us the money. Anyway, so there are some herbs that work to treat Bartonella. One is Monolaurin, one is black cumin, Japanese knotweed, wormwood, walnut, Houttuynia. Those are my favorite go-tos for Bartonella in terms of herbs. And for drugs, you can use Doxy, you can use Minocycline, Zithromax, Rifampin, Bactrim, Cipro, which is a fluoroquinolone, which is dangerous. I don't like to use that drug. And probably the drug that I think works the best is Methylene Blue. And that's not even an antibiotic. You do have to get it from a compounding pharmacy, but it's not an antibiotic, and it works great for Bartonella. So Methylene Blue, Rifampin, Mino, and Zithromax is a good combo for Bartonella. For late stage, obviously, people that have had it for, many years, you have to really hit it hard. I've never seen anybody get well on just herbs alone with Bartonella. Bartonella is very difficult to treat because it has massive biofilms, and it just lives in the biofilm and just causes havoc. I have seen, and myself, I've experienced remission for many years. I was in remission for like 10 years. Then I moved, and that just did me in. And then there's been a couple of other things that have, I had a really bad horse accident, and I relapsed terribly in 2019. So, anyways, Bartonella is a very difficult infection to treat. You can use herbs and antibiotics. I like to combine them both and use biofilm busters, and that's your best bet to eradicate BART. I hope you found this information useful, and I hope you have a wonderful day. Take care.